So your patient is nauseous. What are the medications that we use to treat nausea and how are they best used? Let's talk about Zofran first. So Zofran might be the medication that we reach for first, but it's not always the best option. So when is it the best option? Well, Zofran binds to receptors in the brain and in the gut, which makes it really great for chemo, GI bugs, and post-op nausea. Remember that Zofran doesn't actually touch on dopamine or histamines, so if your patient is vomiting from either vertigo or migraines, you might actually not get much benefit from Zofran. So a pro tip is always watch your QTC interval because Zofran can actually prolong that QTC interval. Make sure the patient isn't on other meds that may prolong that QTC. And then also watch out for Zofran getting pushed too fast because if you push Zofran a little too fast, you may cause a really bad headache. Zofran is our go-to medication for nausea, but there are better options out there. Stay tuned for more medications. If Zofran didn't work, this just might. However, be careful how you give it. Let's talk about Phenergan or Promethazine. So Phenergan blocks dopamine in the brain, which makes it really great for either migraines or motion sickness or cyclic nausea. Now, Phenergan also hits a little bit of those histamine receptors, which could be a little sedative in nature. That could be good or bad depending on the patient that you have in front of you. Remember to never give Phenergan fast. It could cause severe tissue damage or even necrosis. Make sure to dilute Phenergan before you give it and give it nice and slow. Also remember that Phenergan could cause extrapyramidal symptoms in the young and the elderly, so be very careful of that. Phenergan is a heavy hitter. It really hits hard. However, you got to be super duper careful with it. It goes really well with morphine if you're trying to knock out pain and nausea at the same time. They go hand in hand and really help each other. If you have any questions about Phenergan, please leave them in the comments. If you have a hard-hitting nausea, you might need to pull out an equally hard hitter. Let's talk about Compazine. So Compazine hits on the dopamine receptor, which means it's really great for migraine-related nausea. It's also great for cyclic nausea, and then it's really great for psych-related nausea, things like anxiety or panic attacks. Remember, Compazine is not as sedative as Phenergan is, but it's not super gentle either. A concern with Compazine is it can cause extrapyramidal symptoms. Think dystonia or Parkinsonism, so be really careful when giving it, especially when giving it super fast. You can pair it with Benadryl as well if you're really concerned about EPS. However, just be careful with the sedative effects of both of them together. And that's what you need to know about Compazine. Let me know in the comments if you have any questions about it. So not all nausea starts in the stomach, but when it does, Reglan is your go-to move. So Reglan blocks dopamine and helps with gut motility. So if you're having problems with nausea from gastroparesis or maybe delayed GI emptying or even some chemo-related nausea, Reglan is your go-to move. In theory, if food's not moving, Reglan will help it get there. A big concern is that dystonia is a huge risk with Reglan. So make sure you're pushing it really slowly. Another thing is don't give it to your patients with Parkinson's or patients with GI obstruction. Okay, make sure those are the two people you don't give it to. And that's Reglan in a nutshell. Make sure to give it slow and it helps that gut move. Let me know if you have any questions about Reglan. Did you know that we use Benadryl to sometimes treat nausea? Fun fact, it's actually one of my favorite treatments for nausea that I give out in the ambulance. So Benadryl is an antihistamine, and we use it to treat nausea that comes from motion sickness or from a histamine cause. We also use it in conjunction with a couple other meds to help prevent dystonia, meds like Phenergan, Compazine, or even Reglan. Benadryl actually has a sedative effect, so it's really great for anxiety-driven nausea, but just be really careful in the elderly because it can really cause worsening of delirium. Now, Benadryl should be cautious whenever using other CNS depressants, especially when your patient's already loopy because you don't want to make it much worse. Benadryl is like your backup quarterback. It may not be your first go-to, but it will be ready when you need it. Now, I sometimes maybe make Benadryl my quarterback, but it just depends.